We have a series of real powerhouse speakers who could have filled 2 days, I'm certain, on their own, with all of the knowledge and expertise that they have in each of their respective areas. And so what we've tried to do is to break this into 3 smaller conversations. The first focused on equity and the importance of equity as we think about actions in this work. The second focused on innovation and building collaborative solutions. And then the third looking at policy and advocacy and movement building. So I'll sort of remind you of those things as we go through the different speakers today, but think about this as a continuum of these 3 conversations in thinking through what collective action is possible as a result of what you have heard over these 2 days. I have to thank and applaud Mount Sinai for having this important conversation, for raising what may to many seem an intractable problem, but to us in the room, we know that this is solvable, not just because there's a compelling mandate to do it, but because we have each of you in the room. We have the tools and resources and capacity and thinking that you bring, as well as what our esteemed panelists bring to this problem. And so we know that we are in this together and that we can do this work together. At the Clinton Foundation, that is part of our DNA and our ethos, is thinking through problems, through cross-sector collaborations, partnerships of purpose, and understanding and knowing that we do not have all of the answers, as none of us do as individuals, but that we can bring together and help to bring together and be a part of conversations of bringing together those who have pieces to fit together to create innovative solutions, to have a mind toward equity, and to build movements toward the social change that we all seek. With that, I am going to introduce our first panel and get right to the conversation. We have Rumeli, who's here with us today, the program officer for child well-being at the Doris Charitable Foundation, and Winette Saunders, who's here as Deputy Commissioner of the New York City Department of Corrections. We had hoped as well that Anna Oliveira would be with us. Unfortunately, she's ill this afternoon, and so we're going to get even more time with the 2 great women that we have here with us today. So really looking forward to starting this conversation. And as a former teacher, I'm actually not so comfortable behind podiums, so I'm going to sit with the 2 of you so that we can have a dialogue. So thank you to both of you for being here this afternoon and for lending your voice to this very important topic and the very important idea of creating collective action around this work. So I'm going to start by just asking you to briefly introduce yourselves, how you see your role in ending violence against children, and your organization, and more broadly, your sector's role in that work. And Rumeli, we'll start with you.
Sure. So good afternoon, everyone. I am the program officer in the Child Wellbeing Program at the Doris Charitable Foundation. And just to give a broad what the Doris Charitable Foundation does, so we work to improve the lives of people by supporting projects in 4 broad program areas: the arts, environment, medical research, and child well-being. And so in the Child Wellbeing Program, our mission is to promote children's healthy development and protect them from child abuse and neglect. And so we're a national funder. We take a public health approach to the projects that we fund and a prevention lens. And so we work to end violence against children and adolescents in several ways, and I'd like to talk about our funding in 3 buckets. The first is we recognize that the best way to support children and families is to support the communities in which they live. And so with that, we fund projects that do place-based work, the organizations that we fund, they're known as backbone support organizations, and they take this collective impact approach to the work that they do, and this is in recognition that the agencies and the various public serving agencies, organizations that work to support families tend to touch the same families. And so what we're aiming to do is to increase cross-sector collaboration among city agencies and those community-based organizations. And so these sectors include child welfare, juvenile justice, education, early education, housing, and the backbone organizations bring more resources to the community and align those resources to better support the community. The second area or bucket that we fund in is supporting organizations that provide direct services to populations that are particularly vulnerable to child abuse and neglect. So these include low-income families, youth in and transitioning out of foster care, and Native American families. And so the programs that we support, they aim to improve health, education, and developmental outcomes in underserved children and youth, including those that have experienced abuse and violence. And the third bucket is supporting the development and dissemination of knowledge, particularly in translating research about best practices and evidence-based programs to policy and practice. So we fund learning communities that enable leaders in community-based organizations, state and city agencies, practitioners, researchers to come together to learn about each other's work, share lessons learned and best practices, and jointly problem solve on pressing issues. So some of the common themes and the areas that we fund to end violence against children and adolescents. I've heard some of these over the last 2 days, but I just want to emphasize them a little bit more. So in keeping with our prevention lens, we seek to build on the strengths and assets of individuals, families, and communities. So too often the focus is on negative statistics of people and communities, such as poverty rates, high school dropout and unemployment rates, the prevalence of violence. And so while it is important to report on and acknowledge these kind of negative outcomes, we also want to talk about the assets that communities and especially underserved communities, what are the assets that they have? So these might include active participation of residents in community groups and neighborhood associations, the bonds that extended families and the social capital of informal networks, and a strong community identity and sense of belonging. So these strengths can bring communities together to end violence against children. Other areas that we particularly emphasize, so I talked a little bit about system strengthening and cross-sector collaboration to better align resources and funding. We also, in the work that we do, support the 2-generation or whole family approach, recognizing that children don't grow up in a bubble, and in order to support children, we really do need to support the families and the adult caregivers and address the stressors that are in their lives that can make them vulnerable to violence. And we also support building the data and evaluation capacity of the organizations that we support so that they can better communicate about the effectiveness of the programs and their efforts to prevent child maltreatment, as well as using that data to inform their decision making about how to better promote population health and prevent child maltreatment. And then one really important area that we really encourage our grantees to focus on is including family, resident, community voice in all of the work that they do. Often we think about children, youth, families as important stakeholders in the work and in the work of preventing child maltreatment, but we don't hear and we don't listen to what their experiences are and what their voices and what their perspectives are, and we try to incorporate that into our work to really ensure that we're addressing what their needs are. And so then I'll just add, just as philanthropy as a sector in general, so in addition to the funding support that we provide, I see us as having a lot of convening power to bringing together various stakeholders that have different perspectives, that are working on different aspects of ending child abuse and ending violence against children. And so we, as funders, can really bring people together to share that knowledge and also send a message about what we can do to promote collaboration and joint efforts to prevent violence.
Fantastic, thank you. And I appreciate you bringing to light the importance of looking at the assets in a community and understanding the particular infrastructure, culture, opportunity within a community, as well as looking at those gaps or those areas for improvement. Thank you.
Good afternoon, everyone. First and foremost, I want to thank you, Dr. Diaz, and Mount Sinai for including the New York City Department of Correction in this conversation. Traditionally, people do not see the Department of Correction or law enforcement as partners in this discussion. And I want to recognize you for the fact that the collaboration and all hands on deck mentality that Mount Sinai has, this is the only way that this issue will be resolved if we all talk about it. So I want to thank you. So with that being said, I want to say that the New York City Department of Correction, as many people may know, is the second largest jail system in the country. We are also one of 2 states that consider 16 and 17-year-olds adults, and we're one of 11 states that consider, well, one of 2 that consider a 16-year-old adult, and one of 11 that consider a 17-year-old adult. Thank goodness Mayor de Blasio and Governor Cuomo has determined that enough is enough, and that in 2020, the age of criminal responsibility will be changed to 18 years of age. So in 2020, that will change. So that's the good news. In October of this year, all kids ages 16 and 17 will be coming off of Rikers Island. So that's another good thing that's going to happen. I like to start off with the good news first. So with that being said, about 8,700 people, for the first time in 30 years, the entire population within the department's custody has been lowered to 8,760. For many years, we were 20,000 plus. So right now, we're going in the right direction. Of that number, about 121 are adolescent 16 to 17-year-old males, and 5, as of yesterday, 16 and 17-year-old females. In addition to that, we have about 811 young adults between the ages of 18 to 21. It's important to note that in 2014, this administration began to look at how could we treat 16 and 17-year-olds, and we took it a step further and expanded it to 18 to 21-year-olds differently. Although the state recognizes a 16-year-old as an adult, many of us may remember what we were like at 16, and we were hardly adults. And so with that being said, I'm very proud to have been part of the reform efforts and also led the Division of Youthful Offender Programming for the department in 2014. The division was created to really look at the needs of the 16 to 21-year-old population in the department's custody and really determine what type of programming and policies need to address young people who are in the custody of the department. So there were a number of different strategies that we put into place from 2014 to present. And one was staff training. Prior to 2014, if you were a employee of the Department of Correction, you received the same exact training regardless of the population that you were going to be servicing. So with those changes in 2014, we implemented adolescent brain development, safe crisis management, and other de-escalation strategies and techniques for staff that are working with this population, because we recognize that the developmental age that they're in is very different from one of an adult. So with that being said, we did that. In addition to that, we also went through a very selective screening process to identify people who would like to work with this population, because there are many people that don't recognize that 16 and 17-year-olds are a part of the system. They're assuming they're in juvenile where they should be, but they're not. So starting off by even looking at people who have expertise or who want to work with young people was a very important step that we took as a department. In addition to that, we also changed many of our policies. The one that I am most proud of is the elimination of punitive seg and the development of alternative housing areas to address our most violent or assaultive youth. For those of you who may not be aware of the term punitive seg, many people call it solitary confinement, but it is when someone in custody actually commits a crime, they might be given a sentence of X number of days to be in their cell for 23 hours or more. That action, we have learned through research, is not appropriate for a developmental brain. So we ended that practice for 16 to 21-year-olds. For 16 and 17-year-olds in 2014, and in 2015 and 2016 for 18 to 21-year-olds. And then we developed a more structured programming for young people and a more collaborative process that would include the expertise of our health and hospitals, mental health, and health providers to assist us with making sure that these young people who are exhibiting this type of behavior were identified and looked at and treated differently. DOE and Tim Lasante, Dr. Lasante is here in the crowd. He's also been a very supportive partner and has helped us move this effort along. In addition to that, we really have broken the silos, if you will. We recognize as a department that this is new for us. We started in 2014, but there are tons of other experts in this area that we've called on, that we've contacted, that we've gone across the nation to look at best juvenile justice practices so that we can build a strategy that really supports young people. So those are some of the things that I wanted to highlight for you, but there are tons of other things we could talk about.
Yeah, thank you. There are so many things that we could talk about and so many salient points that have already been made, especially with voice that both of you gave to listening to those communities that we seek to serve, to listening to young people. I think it was such a great way to end the previous panel to say, children have an awareness about their circumstances, about their life, about their dreams, about who they want to become, and to listen to them as we craft systems with which they engage that may be invisible to them sometimes. They don't know that it's a system that they're interacting with, but they know what works for them and what doesn't work for them. As we worked with stakeholders in San Diego in partnership with the San Diego Foundation and San Diego County, particularly in child welfare and juvenile justice, it was young people that, as some of these leaders and stakeholders were crafting what they thought needed to happen differently within the system, who said, yes, we do need mentors. We need those meaningful connections to people. But I don't necessarily want a peer mentor. I want someone who's been through that lived experience but has some acumen and something that they've come through it. And so listening to them about what these needs are, I think, is so important and speaks to our next question regarding the cycle of violence that's been talked about so much and that was mentioned in terms of generational culture and aspects. How do you define the relationship between violence and abuse in childhood and adolescence, and how can we better understand lived experiences of those young people and their adult caregivers to design solutions that are more tailored to the varied needs and that highlight the assets that we've heard about? And I'll let anybody start, yeah.
So more important than the definition itself is the fact that we know, or we believe as a department, that many of our constituents and the population have actually experienced trauma or violence personally or by bystander experience. So knowing that, we are trying to train staff in trauma-informed care practices and also in, and I can't say this enough, but safe crisis management techniques to really treat everyone with a soft touch in recognizing that this might be their past and that we need to help them along this cycle. With that being said, we have also developed a very structured programming portfolio that includes dialectical behavior therapy, interactive journaling, and a lot of other evidence-based practice that we think will allow young people to have some of that, some of those issues resolved or even come to the surface, not resolved, but come to the surface so that it can be addressed.
Great, thank you.
And then, so I'll just add from my perspective. So for what we've been hearing the last 2 days, but also what we know from the research is that experiences during childhood, they are especially influential in shaping our brains, the ways that we interact to various situations, and the future our future patterns of behavior. And so children who have been exposed to violence and abuse during childhood carry those experiences with them into adolescence, which may increase the likelihood of them engaging in risky behaviors, increase the likelihood of poor developmental outcomes, or experiencing or perpetrating violence. And so we really do need to understand the context of what's going on in their lives and in their family lives, and helping and supporting parents and caregivers to reduce the stresses in their lives and meet their needs so that we can prevent violence against children and break those cycles of violence. So at the Doris Duke Charitable Foundation, we believe that prevention and meeting the needs of families in communities in which they live, building on their assets, as I've talked about, increasing access to services that address both the social determinants of health, including health and mental health, educational opportunities, and also addressing and finding programming, supporting programming to look at what those negative consequences of adverse childhood experiences, toxic stress and abuse, trauma, those are the key components to breaking the cycle of violence. And in supporting the whole family, we've been working a lot to think about the needs of some neglected populations. So for example, fathers and people that have been incarcerated that are returning to their communities. And what can we do to support them in the skills that they might need in education, employment opportunities, in parenting skills, in their basic needs like housing and support and skills and supports to reintegrate into the community. So by recognizing what those needs might be, looking at what who's part of the family and what's the context that they live in, we can better support collaboration across sectors, and families and communities can be better supported to end violence.
Thank you, thank you. I love thinking about those unique experiences that just because someone has had interaction with the justice system, or just because someone has had a violent situation in their past, it doesn't mean that those experiences are equal to each other or were internalized in the same way. And so really listening and having that eye to things, I think, is important. I was reading an article recently about Airbnb, of all things, and in 2009 they had about 1,000 users, both clients and areas. They were in Silicon Valley. They had all kinds of data about the hotel industry and travel. They had solved or come up with a solution that they thought would work to solve the problem that they were seeing, and then they took it to market. And put it out for people to use, still sort of sitting with their data, their research, their understanding of the problem that they could glean. And as they were struggling, trying to figure out, is this really going to work or not, in the boardroom, from kind of the end of the table, someone piped up, the story goes, and said, we're sitting here in California. We've got about 1,000 users, 80% of whom are in New York City. Go ask them why they're using it. Go ask them what works for them and what doesn't work for them. And user experience became a buzzword in the tech field, and that being another layer of how solutions are developed. And so I use that example because as we think about the user experience of the programs, the systems, the policies that are made, what type of reform of the child welfare, education, and justice systems do you believe is needed and possible to solve this issue of childhood violence? And what are we missing when it comes to equity in those systems? And how can using an equity lens increase positive outcomes for children? In 5 minutes or less.
So I'll start with that one. So I think going back to what you're saying about Airbnb and data, and so I think what's really important in trying to reform some of these systems and for them to work more collaboratively, again, recognizing that they do tend to touch the same families, are data sharing agreements, and being able to connect families to get a better sense of the services that they need, the services that they're using, what their experiences are, and being able to follow them longitudinally and say, are we really serving these families in the ways that they need, and are we really addressing their issues and what's going on in their lives with that goal of preventing child abuse and neglect, with the goal of preventing violence. And so thinking about what, in addition to data sharing, what else is happening in our systems? Where are the systemic barriers? Where is those structural barriers? Where are the biases that prevent some families that are underserved, and these underserved populations, from really, where are those disparities coming from? And so, and then another suggestion I would have for system reform is to acknowledge that developing and strengthening partnerships. So, I've been talking a lot about cross-systems collaboration, recognizing that does take time, and developing these data sharing, integrated data systems, but even just those relationships do take time. As far as what we're missing, I think that we've all heard it before, but maybe aren't doing enough to address this, that those that are most vulnerable and are the most underserved actually do need a larger portion of the resources. So in order for us to talk about achieving equity, we can't distribute the resources equally. We really have to think about who are the super users in the systems, in the child welfare system, in the healthcare system, in the justice system, and what are the resources that these underserved families, the ones that might be marginalized, the ones that aren't getting their voices heard or their needs met, what kinds of resources do they need, and what kinds of resources can we give them to better support and help them to really have some positive family functioning and to really work together as a family. One other one other thing in talking about inequities is we often talk about disparities among Black or Latino and white populations, but recognizing that there are other minority groups. So I mentioned before that at DDCF, one of our populations of particular interest is Native American families. They don't just live on reservations in remote areas. There are a lot of Native Americans that live in urban centers and in urban communities. Kind of going along with what I was talking about data and data sharing is also being able to disaggregate data and to talk about these different populations and the characteristics that they might have and what their specific or unique needs are. This is also for Asian American populations where, depending on country of origin, there are different outcomes that might occur. So that might help to address some of the inequity. And I'll just stop there.
Well, I think my colleague said it best, but I'll try to just give a few more words to to actually add to what she said. But collaboration, I think is the key. I also think that cultural diversity training for different organizations and city agencies is key. I often think what Ashley just mentioned resonated with me in terms of making sure that the user experience of all the city agencies and all of the systems that we're looking at is explored fully, and people have a voice with regard to what works for them, what doesn't work for them, and also serve as a partner in the solution to some of these issues that we talked about today.
Thank you so much. I think we might have time for one question. And so while folks are, one or two maybe, depending on how quick they are. So while folks are moving to the microphone, I'm going to ask, just in a word, or two or three, why is equity essential to ending violence against young people?
It's just.
It just is. But again, I'll put that plug in for family voice and the experiences of youth and families. If they aren't heard, then we can't achieve equity because we won't have that understanding of what their experiences and perspectives are.
Great, fantastic. I think we have someone, yeah.
Hi. So my question is, what proportion of the children or adolescents that are involved in the criminal justice system do you believe have been involved in a violent home or have been abused? And how do you think that affects the way that they are inside of the system, like once they are in Rikers or?
So I think that because New York City has been treating 16 and 17-year-olds as adults, all the information that we get about them is self-reported. So we think that much of this information that you just asked about is underreported. So the reason why we treat everybody as if they have been a victim of violence or trauma, it's because we don't really know the number. We can't quantify it. But just knowing that, I think the department, or maybe I'm just talking about for myself, I feel like we serve the most vulnerable population in New York City. Mm-hmm. And I just think that knowing that they're the most vulnerable is that we should make the assumption that all the services that are available, they need to have and they need to have access to. I hope I answered the question. You're welcome.
Hi. I had a question about restorative practices and restorative justice. I know it's a big hot topic right now, especially in the education system. So if you wouldn't mind just elaborating on it, if it's being utilized in your systems.
So currently, we have about 2 different pilots happening in partnership with Columbia University that uses the restorative practice lens. And so right now, we're still in that pilot phase to look at how that's going to really impact. The challenge is that 82% of the population are detainees. So part of it is when you are utilizing restorative justice practices, you're actually saying, I did something. And 82% of the population are detainees. They have not been convicted of a crime. So we could use the principles, but that fact alone, it's a little bit difficult to implement the way it was initially created.
I have another question.
Sure.
And since a lot of the population are detainees, and there are a lot of violent acts occurring inside, how do you think that affects the way that they are, I guess, developing now? Because they're still in that development phase, right? So they're still 16 and 17-year-olds. How do you think that's affecting or further affecting what they've already been, the trauma that they have already experienced?
So I think that, any child, any adult that is incarcerated, it has to be affecting them adversely. There's nothing good about being in jail, regardless of all the great programming or all the efforts that many of our partners do. The fact that they're in jail is adverse. So we're trying our best to do what we can to support them while they're in custody. But I think the most important step that we took in 2015, well, actually in 2016, is to develop the department's first reentry program for 16 and 17-year-olds. So that, to me, is the most important step, because the kids are with us for a certain period of time, but when they leave us, I don't want them to have to come back to get those services. They need to be available in the communities in which they reside so that they can be supported, so that we can reduce the recidivism.
Thank you. And as I promised, these conversations could have been our 2-day schedule. So I hate to cut this off, but just want to say thank you so much. You are heroes and champions, and not just for being here today, but for the work that you do each day for children and families. Thank you. It was a real pleasure.
Thank you.